Mark Sommerfeld here. I'm the program director. I've actually asked a couple of our residents to help out with the presentation. I'll be sharing a few slides as well, but Dason, Sedora, and Aspen Lillywhite are here with us. So Dason, you want to kick us off?
Yeah, sounds good. Hey everyone, my name is Jason. I'm one of the R2s here at the U of A program. This is
Hey, I'm Aspen. I'm one of the R1s here.
so yeah, we'll get the presentation started here. Um, Obviously, we're here in Edmonton, just a little bit north of Calgary. In terms of residency, obviously it's going to be very challenging wherever you go. So one big thing we kind of wanted to highlight is life outside of residency, and kind of what our program brings in terms of that. So obviously important to be supported from both a academic standpoint as well as a kind of collegiality and social standpoint. So from more of the academic support standpoint, we have a great faculty here with a resident well-being committee and residency kind of outreach options. I know myself, I transferred into the program from another program, so I've kind of dealt with this committee and some of the people who are involved directly and have nothing but amazing things to speak about in terms of support in terms of a more kind of professional sense and setting. In terms of kind of what our program brings, I think a big thing that a lot of people who come through here notice is kind of the collegiality within our group. I think some of the things that we wanted to highlight are our resident retreat. I know a lot of programs have great retreats and great people involved, but I think that's something that we really bring to the table in terms of supporting one another. Whether it's things with call switch changes last minute, those kind of things. We're always kind of there for one another, no matter what we need. And we have a tight-knit group. This is us at our yearly resident retreat out in Jasper, getting everybody out in the lake when I think it was like minus 30 degrees or something like that. So getting out there for a few hours of hockey and having fun as a group was a great time. So definitely a highlight of every year. As with most programs, we kind of have our annual senior graduation day. So we usually go for a golf tournament just outside of the city. Get to enjoy a nice day with staff and celebrate our graduating residents, and also one of the highlights of Edmonton. Um, Although it is cold in the winters here sometimes, we have an amazing golf scene kind of in and around the city. So if golf is something you love, it's a great spot to be. Um, and then just in terms of kind of life outside and the less, I guess, kind of planned events, we have, multiple days a month usually where we'll get together as a group, go out for dinner, drinks, those kind of things after our academic days, just kind of hang out and, socialize. Picture on the left there is one of our more planned events every year. We go to one of the Oilers games, funded by our program and staff that help set us up for building some Oilers fans. I know I'm slowly turning the tables here. I'm a Maple Leafs fan, but they're trying to convince me to jump on the ship here. I know the playoff runs have been great the last few years. And then Edmonton itself, I know it's one of those cities that I think maybe gets a hard time from time to time, but it's honestly a beautiful city. And there's so much to do year round, whether it's from professional sporting events. We have the Oilers, the Riverhawks, our baseball team, and the Edmonton Elks, our football team. We're kind of known as the festival city as well. So like year round, we have things such as our Fringe Festival, Taste of Edmonton, an internationally kind of renowned music festival called Folk Festival. And then I know Calgary usually does have us beat in terms of proximity to the mountains, but we are also close. It's about a 3 to 4 hour drive. And I know for myself, I enjoy going to the mountains, and I think it's easy to make a trip out there kind of once a month, even though we're a few hours away. It's definitely something that's very accessible, kind of whenever you want to go. Um, I think that's kind of it from my standpoint. And again, just kind of wanted to highlight the, I guess, collegiality we have within this program here, and the support from both more academic professional side and then just within our resident group. It's an awesome bunch to be part of.
Yeah, I'll jump in here. This was our resident party this summer, as we were welcomed into the bunch, and it was honestly really fun to meet some staff, to meet the senior residents, and just really get integrated from day one and feeling super welcomed. And then to start strong every year, we have our boot camp in the summer, and part of that's our casting session. You learn the skills of casting, but I think it's just as much team building and some good fun with one another. There's some more nice splints and casts. We also have our Christmas party every year. It's a little bit more of a formal event. We get dressed up more than our scrubs day to day. And then in terms of the more academic side of things, we'll let Dr. Sommerfeld take over and give you the nitty gritty.
Thanks, Aspen. Yeah, a big strength of our program is our competency committee. We have all of our residents are paired up with excellent and engaged staff who act as their academic advisor. And our committee is really focused at not just being EPA checkers, but on reviewing how residents are doing and then providing meaningful feedback and encouragement that's specific to them and to what they might need to focus on. So we obviously follow the Royal College CBD program. The university employs a pretty helpful EPA tracking system that we utilize and find quite helpful. Maybe switch to the next one. Yeah, thanks. We we're not quite as big as Calgary in terms of staff numbers, but we're not far behind, and our residency program is a little smaller. So the staff to resident ratio is actually quite favorable. There's very little, you see very little crowding in the OR with it being rare that there's more than one resident in a room. We're not a fellow heavy program. We have variable numbers of fellows, including trauma and arthroplasty and sports fellows, but with the staff to resident ratios, there's plenty of ORs to go around for the fellows and the residents. Edmonton is a very large catchment of a lot of the north, and the trauma volume is second to none. Our residents consistently go for fellowship and land in jobs where they're known as competent and excellent surgeons. And I think that that's probably the strength of our program, is just that we produce confident and capable surgeons. We accept 4 residents through the CARMS match. Last year, we accepted 2 sponsored trainees from the Gulf states. And this year, we're accepting 2 again. So right now we have 22 residents. Next year we will have 24, but we're trying to land at about 25 to 27 residents. And that is a little bit of an increase from years past, but with the staff to resident ratio that we have, we think it will be beneficial to grow the program a little bit over the next several years. We don't need to send residents to any other cities. All the training that you need is right here in Edmonton. Research is an important aspect in our program, and we have the support to help you accomplish it. We have a collaborative orthopedic research office with one member of their office who is assigned to basically work with the residents in keeping their projects moving forward. We do have a curriculum of research-focused topics that are scheduled into the academic half day on an annual basis. And this area of our program has, I think, been strengthened over the last several years and is a positive for sure. We do have some requirements. I don't think that they're any more stringent than other programs, but when you come to the University of Alberta program, you'll feel well supported in your research efforts. This is just a picture of our research day. We hold this at the beginning of May every day. Next year, I'm looking forward to welcoming one of my mentors from Ohio State University, where I did my fellowship, Dave Flanagan. But it's a great opportunity to have the residents up at the podium, sharing their research, and then having a nice social event as well.
I'll pop back in here. So within our program, we have the chance to go down to Ecuador with the CAMTA, the Canadian Association of Medical Teams Abroad. It's a team of about 30 nurses, family docs, anesthesiologists, and orthopedic surgeons that go down and primarily do hip arthroplasty surgery, as well as in the pediatric population, looking at some complex clubfoot deformity surgery and hip dysplasia surgeries. I had the chance to go as a medical student in the 2025 mission. And it really was probably one of the most life-changing experiences I've had. From an orthopedic standpoint, you're seeing deformity far more extreme than you never encounter in Canada, because you're seeing hip dysplasia that was never treated as a child, and now you're doing hip replacements on those patients as adults. So just a really unique learning experience from an academic standpoint, but then you're also getting unparalleled mentorship during those tightly knit 10 days with mostly surgeons from Edmonton, but also from Canada at large, and getting that networking opportunity as well. So a really unique chance within our program to go, I think, as in our 3 or our 4 typically. Yeah. I guess I'll finish this off with our strengths of our program. As someone who's recently been in your shoes just this last year, I find that every program has very similar highlights. Everyone's going to offer research. You're going to be really well trained wherever you go. And I think the most important thing is finding what do you want in your program. And for me, U of A was the people. It really was having strong mentors who I would look up to and could see myself becoming, both at the resident level and at the staff level. And I think that's created a really strong program where residents really are involved in that process and creating the program into what it is day to day. As we've mentioned, you're getting access to all aspects of orthopedic training. It's really organized, and you're getting your schedules. You're getting good teaching regularly throughout the week. But truly, it's at the educator's care here. They're invested in your learning and your success, not only as a resident, but invested in your career at large. And I think I felt that already in the first 4 months of my program here. I've been on the ortho service the first 4 months, so I've been really privileged. But I've just felt super supported, and I'm really stoked that this is where I ended up, and happy to spend the rest of my 4.5 years here. One last thing I'd certainly highlight is the volume we have here. It's certainly a work hard, play hard program. You're doing a lot of work on your call shifts. It is busy, but you have just the more reps you get in, the more practice you get, and the better you'll be at the end of the day. And I think that was another huge reason for me why I chose U of A, and I'm really happy I'm here. And then, yeah, we got the CBD program, and we love EPAs. We'll never let them go. And I think that's everything.
Thanks, Aspen and Dason. I appreciate it. Yeah, any questions that people have, feel free to email me. You can find my email on our website. More than happy to communicate over email.